Hello everybody, I will be presenting about our experience with the Municipal Health Committee that most of you have been introduced to and have seen during our field visit. To make a long story short, we came to the idea of creating a Municipal Health Committee in the municipality of Majdal Anjar. It was a long way to reach this decision. First, we had the initial insight. It was our mandate in the R4R protocol that sent us to address local healthcare systems. The mapping exercise showed us that municipalities are a very strategic potential to operate this local health system. We got a lot of deliberation through our learning site team meetings, and we had to decide whether we will be going to the district level governance or create a new structure, and what would be this new structure. It should be popular or municipal or professional or humanitarian. And after we decided with the group model building with some municipality members, we came up to the final decision to create a municipal health committee into the municipality of Majdal Anjar. Those who were members of this municipal health committee are three categories of people. First, we have the members of the municipality board. People who are in the municipality board joined this group to work within the municipal health committee. There are also local professionals that the municipal health committee members called, or who came by themselves, or who were designated by the mayor. Yeah, the mayor told us, okay, this one will be in your committee, and we say, okay. We have also with us members of our previous learning site team. Not all of them, but those who were interested and who could add value to this group. Before going into the research by itself, I want to emphasize this slide. I put it after, okay, this slide. We want to emphasize our enthusiasm, our pride, our satisfaction, our hope with everything we are doing. We are very proud of this experience, and we are very proud of our work. We are doing this study. Why? Because we want to understand the challenges and the obstacles, and we want to anticipate the risk of making this project not seeing the light at the end. So the aim and objectives of our study, we are exploring the operational challenges that we encountered so far. We want to assess them, to identify the potential risks, to recommend actionable actions, and to start integrate recommendations for continuous improvement. Our source of data, the primary source of data, is all our observations and our weekly meetings with Joanna while going up to the learning site, coming back from the learning site in the car, and we are documenting everything. The meeting minutes we are taking in our meetings with the Municipal Health Committee, and the reports we are developing for each activity we are doing. And we have additional source of data. It is the WhatsApp group chat, the real-time chats that are going on between all members of the Municipal Health Committee, and the side conversations and discussions, the corridor data, what is called the corridor data collection. We did the thematic analysis. We picked up some of the attributes of effective local governance. We will be looking at transparency, accountability, participation, conflict resolution, and commitment to public welfare. I know that there are much more attributes, but we thought that we had enough material for this, but we are open also to expand later. Findings. We start with technical challenges. We did a survey with all members of the Municipal Health Committee to understand their skills, their capacities, their availability also, and to identify the gaps. And those are the gaps that we identified. We need to learn about project management, social media design, budget and finances, data analysis, evidence-based interventions, collaboration with stakeholders, coordination with humanitarian programs, and also monitoring, evaluation, all those things that go with the project management thing. And we started capacity building. We had already 2 training workshops today, the strategic planning workshop and the communication and leadership workshop. And we have already planned for evidence-based planning, data management. We are waiting just to have some data. Maybe if we can get this census, it will be a very good opportunity to start this training based on the data we are collecting. Negotiation and networking, and other training teams. Every day there is a new training team that is being proposed. We start with transparency. What we found challenges in transparency, there are external challenges and internal challenges. So external challenges is the relationship with other stakeholders in the region, UN, international donors, and even the Ministry of Public Health do not share data pertaining to the village. The village cannot get data pertaining to the village. There is data exchange with all those, with UN, with international donors, and with MOPH, but they don't give back this data to the Municipal Health Committee. And we have internal challenges. Some Municipal Health Committee members, they are still engaging in secret deals with particular donors to implement certain programs without telling. And there is a tendency of promoting their protégés to fulfill some task within those programs. And even when they are watched, they do it. Anyways, they do it. And what we are recommending starting negotiate a reporting mechanism with all those external stakeholders and to ascertain the authority of the Municipal Health Committee to ask for data, and ethical promotion to remind again and again clear guideline for promoting individuals. Next. The challenges for the accountability of our project, there are many. The members themselves, they are inconsistent in their task fulfillment. They take a task and they don't deliver without giving any justification. There are yet ineffective meeting minutes. Meeting minutes are not taken seriously, and the minutes are not shared after the meeting. They lack result orientation. They are more into the process than into the outcome. For them, the process is very important. They don't really care about the outcome. And there is a data accountability gaps. They throw on you numbers. They tell you 70%, 100%, etc., without any evidence. They cannot cite any source of those numbers. And they have ideas like why we don't inflate the number to get more funds, things like that. So there is a serious problem of accountability. What we want to do is capacity building, to provide training on all those techniques of statistics, data management, privatization, all this, to watch better the minutes taking and sharing. And the most important, we want to do something that is called a self-evaluation workshop, to gather them and to make them assess their performance and gather their perceptions and see what are the identified issues by them. Participation here too, we still have problems in punctuality. They come late, they don't come, they don't apologize when they don't come. They don't behave like the owners of the project. They always behave like they have to receive something from us. They don't behave like they are also this is their project and they need to put effort in it. Some do not participate at all, and others participate on every occasion, even if they repeat what has been just told before. So participation for participation, and some others don't participate at all. Some are inattentive, they are on their phone, they go and come back to the room without any problem. So here too, what we are trying to mitigate it, we are insisting on the meeting norms, expectation. We are trying to do structural discussions into this meeting and reinforcing the assignments and the roles of everybody. In terms of conflict resolution, we had to go through tensions at several occasions during our experience with them. The tension, including interaction with us, with AUB team, result from unmet expectations. They don't tell those expectations, but they are frustrated when those expectations are not met. And it is more or less related to a potential eventual benefit allocation. Like, for example, when we gathered school directors, the municipality allocated to them $10, and they came to us to be very frustrated that how you say you don't have money, and look, you distributed $10 to school directors. The problem is that if they are frustrated, if they have a problem, they just leave. They don't come anymore to the meetings. They leave the WhatsApp group, and without any explanation, without coming for clarification, nothing. They just leave. To the point that the mayor had to step in several times to discipline them, to put them again into the streamline. So he told one of them, "You are not an employee, you are elected, and your responsibility is to the administered population who elected you. So you cannot simply leave at your discretion." And the mayor is one of our allies in this keeping them together. And this is the most important point of this, because this point, the commitment to public welfare, has given the rise for all the obstacles and challenges that we have previously highlighted. What does it signify? It signifies that members' authentic dedication to the health and well-being of the population. Are they really dedicated to this? And I think that Sushil was aware about this point, and he is right. Are they really dedicated, or they are just acting like dedication? And it determines really whether the Municipal Health Committee will ultimately serve as a program manager utilizing international funds for ad hoc services, or if it truly embraces the cause of equitable access, inclusivity, stakeholder collaboration, evidence-based planning, and sustainable health programs. And so far, the misalignment observed that the behavior of the members sometimes diverges from their collectively developed vision. And they exhibit like attitudes like they used to do before, positioning themselves, wanting more influence, wanting more political power, being at the place where they can have access to eventual benefits that will come in their perception. Rather than establishing really a local authority that is accountable and responsible for the health of people they manage. And this dynamics fosters always a competition between them, where members race for more influential position within the Municipal Health Committee. How to promote the shift? First, we have two good news. The first good news is that since we started till now, it is the last one, almost. Since we started till now, there has been a progress. There has been a progress. We saw a progress, a positive shift in their attitude. At least the speech has been different. And we understood that when we saw other members of other municipalities. And the second good news is that the introduction of female members into the Municipal Health Committee has promoted and encouraged this culture of improved performance. Women do not subscribe to whatever I said before. They don't compete, they don't do all this. Usually, okay? Not all. Commitment to our vision. We stay committed, we stay committed to our vision, and we strategically compromise. We compromise things, and we don't compromise others. And we engage with international donors with this speech, with this discourse, to make sure that international donors get interested by this task. And the last one. This is the last one. Okay, so that what we need is the culture shift. So we are aiming a culture shift, and this is the stake. Next. It is not really very straightforward. It needs work among Municipal Health Committee members and among national and international health stewardship that is operational in the region. And this is the last one. I will end with questions. Can science and techniques overcome politics and self-interest? To what extent can the work of researchers reshape prevailing habits, mindsets, and practices? We have a lot of things to change. Mindsets, practices, habits. Okay? How long must we have to go before witnessing a real change? What obstacles are still waiting for us, and what more can be done to boost our work and its efficiency? But one thing is sure, that during this journey we learned a lot, and we know that we will be learning more and more, and at the end this learning side has justified its name. Thank you very much.